So, which is why I find these, so innovation and startups. So Judy went on to say, there's so much money in Silicon Valley for startups. When I go to an innovation conference, I feel like a piece of meat walking around dogs, and I like dogs. She goes on, these are, I just found these, it's kind of comical. I assume people laughed at that. Startups sit at one end of the spectrum of the technology business. At the other end are giant gadget and software makers like Amazon, Alphabet, Apple. In addition, Faulkner mentioned IBM, Microsoft, Netflix, Walmart, among others. We've talked about others on this show. It's too early to say how they'll fare, but some big companies from outside the industry have struggled to impact healthcare in the past. See Google Health and Microsoft Health Vault Insight. Faulkner said in her keynote that it's hard to make meaningful advances in the area of as complex as health IT. And then she went on to say that the EHR is the most complex area in the world, which is health, operates in the area that's the most complex in the world, which is healthcare. She said, I think it's more complex than rocket science. Is Epic saying, look, we're in your corner, as they're saying to this crowd, which is, health systems, we're in your corner, our intentions are good, we've made good progress together. Don't look somewhere else for a shiny object to solve your problem. Their intentions, the Silicon Valley people, may not be good. They've failed in the past, as has been noted. This stuff is really hard. Do you think these comments are a form of, of FUD, of fear, uncertainty, and doubt around startups and tech companies, because they are starting to capture some attention within this space and do hold some promise? I mean, what do you think her thinking was behind really those feisty comments about tech startups and the established players?
I think she's concerned around some of these applications not being HIPAA compliant, and I think that we're all aware of what's gone on with Facebook and Cambridge Analytica, and I think that her concern is around patient data and making sure that patients aren't being directed to inappropriate services, or that their data is being shared in a way that clearly that the patient doesn't understand, and that they're being subjected to advertising, etc. So I think that was probably one motivation. I think the second would be around fragmentation of workflow. And I think that is one of the challenges as it relates to digital health, is how do you incorporate these applications in such a way that it actually makes the workflows more efficient for our physicians and our other providers and nurses, and within a hospital system or a healthcare system, but also from a patient access system and the consumer experience. Just putting apps out there is very confusing for some of our patients. I think that there needs to be an intentional, comprehensive strategy around how do consumers and our patients actually access care at health systems, and it needs to be a very seamless experience. And not a lot of healthcare systems are actually doing that, from my opinion.